Good evening, I'm Chuck Scarborough, and tonight we bring you a story that has shocked the nation. A healthcare worker in Loganville, Georgia has been arrested for actions that have been described as both appalling and exploitative. This case highlights not only the vulnerabilities of disabled individuals in care settings, but also broader systemic issues within the healthcare industry. Lucrecia Cormasa Coyan, a 19-year-old in-home adult daycare worker, was arrested on January 28, 2025, after videos she posted on social media went viral. These videos depicted her engaging in inappropriate and exploitative behavior toward disabled patients under her care.
The footage shows Coyan dancing provocatively over patients, one seated in a chair and another reportedly in a bathtub. In one particularly disturbing instance, she is seen pressing her body against the head of a seated patient while performing suggestive dance moves. This blatant violation of professional boundaries and patient dignity has drawn widespread condemnation from disability rights advocates, law enforcement officials, and the public at large. Coyan was charged with felony exploitation of a disabled person under Georgia law. If convicted, she could face significant prison time. Loganville Police Chief M.D. Lowry expressed his disgust at the incident, stating, "This behavior is appalling and unacceptable. Vulnerable individuals rely on caregivers for compassion and respect, not exploitation." The arrest has sparked outrage across social media platforms, with users calling for stricter oversight in caregiving professions. Disability rights organizations have also weighed in, emphasizing the need for better protections for vulnerable populations.
While this case is shocking, it is unfortunately not an isolated incident. It sheds light on a pervasive problem within the healthcare industry, one that disproportionately affects disabled and elderly individuals who rely on caregivers for their daily needs. According to the Polaris Project, individuals with disabilities face heightened risks of exploitation due to several factors. Dependency on caregivers. Many disabled individuals rely entirely on caregivers for basic needs, like mobility, hygiene, and nutrition. This dependency can create an unequal power dynamic that some may exploit. Learned compliance. Years of being taught to comply with authority figures can make individuals with disabilities more vulnerable to abuse or exploitation. Fear of independence. Internalized fears about their ability to live independently may prevent victims from speaking out or seeking help. Between January 2015 and December 2017 alone, the National Human Trafficking Hotline documented over 2,000 cases involving victims with pre-existing health concerns or disabilities. The issues highlighted by this case are not unique to individual caregivers, but reflect broader systemic failures within healthcare facilities. For example, an investigative series by Capital News Illinois and ProPublica uncovered rampant abuses at Choate Mental Health and Developmental Center in Illinois. Employees were found lying to investigators, leaking sensitive details about abuse cases, and retaliating against whistleblowers. The investigation revealed a pattern of neglect, abuse, and cover-ups at the facility, highlighting the urgent need for reform in institutional care settings. The misconduct extended beyond direct patient care, involving administrative staff and management who failed to address complaints or actively suppressed reports of abuse. Such actions make it nearly impossible to hold perpetrators accountable or protect vulnerable patients effectively. Let's turn now to the legal implications of this case and what it reveals about gaps in regulatory oversight. Coyan's actions fall under felony exploitation laws designed to protect disabled individuals from abuse and neglect. In Illinois last year, Governor J.B. Pritzker signed legislation aimed at strengthening penalties for healthcare workers who cover up abuse or interfere with investigations. Key provisions include reporting misconduct to state healthcare worker registries, barring offenders from working in any healthcare setting, penalizing material obstruction of investigations. Advocates are calling for similar measures nationwide to ensure accountability across all states. On a federal level, laws like the False Claims Act, FCA, and Anti-Kickback Statute, AKS, aim to curb fraud and abuse in healthcare settings. Violations can result in criminal penalties ranging from fines to imprisonment, but enforcement remains inconsistent. Beyond legal consequences, Coyan's actions represent a gross violation of medical ethics. Caregivers are entrusted with safeguarding their patients' dignity and well-being, a responsibility that Coyan flagrantly disregarded. Experts warn that such behavior poses not only emotional but also physical risks to patients. Bacterial transmission. Direct skin-to-skin contact can transfer harmful bacteria from caregiver to patient, especially if hygiene protocols are ignored. Injury risks. Pressing body weight onto a patient's head could cause physical harm. Psychological trauma. Such incidents can leave lasting emotional scars on vulnerable individuals who already face significant challenges.
Public reaction has been swift and unforgiving. Disability rights organizations have condemned Koyan's actions as dehumanizing, while calling for stricter regulations in caregiving professions. One Twitter user wrote, "How does someone like this even get hired? We need better screening processes for caregivers." Another commented, "This isn't just one bad apple, it's a systemic problem that needs fixing now."
As we reflect on this deeply troubling case, it's clear that more must be done to protect society's most vulnerable members. The arrest of Lucrecia Kormasa Koyan serves as both a wake-up call and an opportunity for reform, one we cannot afford to ignore. We urge anyone who suspects abuse or neglect in a caregiving setting to report it immediately. Together, we can work toward creating a system where dignity, safety, and respect are non-negotiable standards for all. Thank you for watching tonight's special report. I'm Chuck Scarborough. Stay tuned for more updates as this story develops on The Donkey's Voice.